Welcome back to Psychedelics Today. This is Joe Moore coming at you from Breckenridge, Colorado. Today on the show, we have Dr. Matt Brown, a psychiatrist in the Chicago area. Matt is on the advisory board of Psychedelics Today. Really appreciate all his support and help there. It's been really great working with him, getting to know him. And I think you are going to like this episode. Matt came to me with the question that he might have found some helpful info on. It's like, what is this stuff energy that we talk about in psychedelics? Do we really have a good answer? And, how do we frame it in our modern Western world? We have a pretty easy, if you're inside the traditional Chinese medicine system or Ayurveda, it's kind of just built in. So how do you, bring that into the West? So a lot of real interesting questions there. We get into that quite a bit. And Matt found some things from his own personal medical tradition that could be helpful for us. So let us know what you think. If you want to give us some feedback, maybe bring it to the Facebook group, facebook.com, and type in Psychedelics Today group and have some conversation there. Or you can email us, psychedelicstodayemail@gmail.com, or just add us on something like Twitter. And it would be great to hear from you, get some feedback on this, and see if we want to go further down this line of thinking. So thank you, Matt, for joining us. It's been, really great working with you over the years, and hope we can have you on again soon. So I think that's it for the intro. If you want to support us, leave us a review on Facebook or any of your podcasting apps or Google. That would really be appreciated. And I think if you want to support us financially, a great way to do that is at patreon.com/psychedelics today. You can start as low as $2 a month, and it comes with some cool perks and some exclusive access to content that we don't really talk about too much on there. Also, you can check out some of our classes. Navigating Psychedelics for Clinicians and Therapists is up at psychedeliceducationcenter.com. You can always buy that and dig in and deepen your professional interest in psychedelics and knowledge set. And we will be announcing soon some live supported dates. It's going to be a little more expensive than before, but we will be announcing soon some dates, and you can be sure to hear about it if you get on our email list. There will be some kind of early bird offers. Maybe you'll save some money if you buy within the first couple weeks, but just stay tuned there. And yeah, can't wait to see you in class. I think that's it for now. Joe Moore signing off for the front end. We'll see you on the other side. Hello, everybody. Welcome back to Psychedelics Today. Today on the show, we have Dr. Matt Brown, a psychiatrist living in the Chicago Metro, advisory board member to Psychedelics Today, CIAS psychedelic program grad in the 2018 cohort. Matt, anything else I missed?
I don't know. That's a pretty good introduction. Thanks, Joe.
Cool. You got it. It's been a while, Matt. I'm glad we got you back on the show. Just appreciate all your support in the past and currently too. And I'm excited for our conversation today. It's going to be pretty interesting, I think.
Yeah, same here. Thanks so much for having me back. And, you and Kyle keep doing amazing stuff. And it's awesome to see how you've been growing this podcast for the last few years.
Oh, thanks. Yeah, it's been fun. What was it last year we tried to run, we did run Navigating Psychedelics for Physicians?
Yeah.
I think that was early 2019, like April maybe. That was fun.
That was good.
Yeah. Yeah, so maybe in the future, but let's see.
We're talking about that. I'd be interested in possibly doing that again. It's just that it's been a busy year from a number of different standpoints, and we're still in the middle of a pandemic, and so that's made everything topsy-turvy. But
yeah. Cool. So you had this cool idea to talk about this phenomenon that we see discussed regularly in psychedelics and in medicine generally, energy. And you did a bunch of research, and turns out you found that your own tradition, kind of osteopathic medicine, had some pretty good things to say about it.
Yeah, well, I mean, if you want to jump right into the deep end, we can go there. So
let's do it.
Yeah, I reached out again just because we really are on the edge of this big sea change with MDMA now. The research will be funded, and all signs point to, as long as they just finish, this will be a prescribable agent within the next handful of years or less. Probably would have been less had we not been in the current pandemic, as we mentioned. So I think it's really, really important that we start to try to figure out what it is that's going on with all of these agents we're using, because psilocybin is going to come next and probably a few other things down the pipeline. And going through the CIIS training and also doing some work with ketamine and other stuff like that, there's a lot of talk about energy, and we all sort of intuitively sense and somewhat understand what we're talking about, but this seems extremely problematic to me mostly from an academic standpoint. So maybe this is getting a little bit nerdy, but because I feel like it is accurate to say that, but it's very, very inspecific, because there's lots of different types of sensations or quote unquote energies that we refer to when we're talking about this. And I think for us to be able to, move this profession of psychedelic medicine forward, we need to kind of be, a little bit better about how we're talking about these kind of things. And, so I was bringing this up. I would talk to a lot of folks in the training, like I said, in California, just kind of riffing on things. And most people either fell into one or two camps. There were some of the people who were more the psychiatrists. They're like, yeah, we talk about this energy stuff, but just don't pay attention to it. It's not a big deal. We all understand the feeling in the room thing, but let the hippies be hippies type of thing. And then there's the opposite side of the folks sort of a lot more like the spiritual healers talking about, well, I don't understand why this is problematic, because this absolutely is what it is. And once you feel it, you understand it, and this is fine. But again, like I said, I was not, I agree with both kind of, but neither one entirely. So I was trying to look to other different traditions to try to explain this. So I read a couple of books on Chinese medicine, acupuncture. I had done some training previously in Qigong work, and so I'm familiar with the concept of Qi. Looked into a little bit more Tibetan Buddhist stuff with the concept of the lung energy, and did some Salong training. And also read some stuff on Tantra, and all of it seemed to kind of sort of work, but like there just seemed to be something missing. And I don't know, I was just going back to just thinking about, okay, how do I feel and experience these things in my own body? And reflecting, I sort of feel like there's three basic modes of just sensations that I get internally. There's much more like this visceral energy type of a thing that seems to be coming from, when you're breathing or your digestive tract or your heart. And that seems somewhat consistent, kind of going up and down. There seems to be some level of quote unquote energy within the musculoskeletal system, especially when muscles are contracted and they have a hard time releasing, or when they do like release and expand. And then finally, there's this like energy that feels more like neurological in general, sort of that, I don't know, just when you're feeling a little bit wound up and you kind of just need to get something out. And so I've been kind of like riffing with this idea that there's like these three different energy components, and I don't have great terminology for any of them exactly. But then thinking about different techniques of doing body work, I then went back to study my old textbooks of osteopathic medicine, because I am a DO. And the difference between DOs and MDs, for folks who are not aware, is that DOs are kind of like MD plus, is a good way of thinking about it. So like we have to learn all the same stuff as your typical allopathic physician, but we also have to learn a lot more about anatomy, physiology, a little bit about nutrition, and like manipulation techniques. Because the whole tenet of osteopathic medicine is that the like structure equals function, and the body has the ability to heal itself. Which that's the other thing too. When thinking about psychedelic medicine, one of the very few other places where you hear about like this concept of the inner healer consistently is in DO school. And so I was looking at this, and I was reminded of this technique, or this theory. I think it's like a biodynamics is what they kind of call it. And the work being done a little bit by James Jealous to kind of expand upon that. But really, this goes back to like the osteopathic principles of there are, hold on just a second, let me pull up. There's different things that contribute to a person. We are mind, body, spirit, but also the things that we interact with very much interplay with our system, such as the biomechanical structural system, the respiratory circular system, the metabolic nutritional system, the neurologic system, And, by changing any one of those, you can kind of shift the other. And then all of a sudden, it kind of started to click together is that this is exactly what we've been looking for. But I don't think that even still within the DO framework, we have great words to parse it out other than identifying them and just kind of calling it where they come from. So I just threw a bunch of stuff at you right away. Maybe we can try to unpack some of that, or maybe we can spin off into some other things. But that's the gist of what's been spinning around in my head for the last few years, and thought I'd like to talk about some.
All right. So let me try to ramble in response.
Sure.
So like, as far as I understand, traditional Chinese medicine, TCM, like a big portion of it is about having the energy blockages kind of eliminated or minimized, like have your body's natural energy circulation rolling. And that's why kind of Qigong is pretty big in China, Tai Chi. Like it helps move those energies around somehow, which is like a really weird way to frame it. And then, in the Western world, when we want to talk about energy, I immediately go to like Wilhelm Reich, who kind of coined this term character vegetoanalysis to release character armor, which is essentially like frozen energy from repressions, because he was a student of Freud. Energy keeping your body in weird positions and creating neuroses and other things, like actual physical disease. And recently, even in Groff, like Groff had something, I think it might have been in his holotropic breathwork book, where he talked about how like certain behavioral or psychic patterns can eventually become energy situations, and then could eventually reify or concretize even more into actual like dysfunction in organs, musculature, joints, whatever. So like, do any of those things seem to rhyme the most with how you're kind of framing it? Or is it kind of more, this is more just like the symptomatology or like how it actually creates problems?
No, well, it's actually sort of all of that and more to an extent, because I feel like each one of these, the things that you're referencing there, are trying to explain a similar type of phenomenon. Is like, how physically and also maybe interpersonally we're experiencing sort of quote unquote energy within and outside of our bodies, and maybe with the rest of the universe. And so I think that, like just the concept that energy is neither created nor destroyed, right? It's just kind of changing shape, right? I mean, this is just basic physics. And so we can kind of shift sort of potential energy into kinetic energy, into electrical energy, into chemical energy. I mean, this is just basic science, right? And we know that all of these things do happen in our body, right? And we know that they do happen naturally in the universe.
Yeah.
But how much are we perceiving these, or how much are we actually consciously perceiving these, versus like how much are we maybe unconsciously perceiving some of these shifts, and how are those sensations maybe manifested? So you brought up a great example about sort of the interplay between the musculoskeletal system and also just like thought process and patterns. So it's somewhat known that, if you're walking around all the time with your shoulders hunched over and kind of leaning forward, this is a little bit more of a closed off, protective kind of a posture. A couple of different things start to happen. A lot of times people start to get a little bit of chest pain, a little bit of upper back pain. And then since you're sort of in this defensive position, that might lead you to more like of a little bit of like an anxious or on edge state, versus if you were kind of holding your shoulders back and up, you might actually start to feel better. And since you're in a more open position, and this is sort of more putting yourself out there, it feels stronger, and you might be less anxious. I mean, this is of course not going to change extreme anxiety, but it's very, very small postural shifts like that absolutely can change how you feel, both physically and mentally.
Right. There's that like Buddhist practice of smiling, and it like has pretty measurable effects, at scale. I don't know about, treating somebody with acute depression that way, but I think your average person might have a pretty profound impact even just from smiling for 2 minutes, or those postures, power poses, or whatever they call them.
Yeah, exactly. And it's not like we're trying to say any of these things are necessarily curative or the one singular thing, but all of these interplays are they're synergistic.
Yeah.
Not necessarily additive. So they work together.
Yeah, right. Like you can do all the psychedelic psychotherapy you want, but if you're still like boozing and having all sorts of bad behavior, doing cocaine all the time, like you're probably not going to have the best outcomes relative to somebody who's trying to be super healthy.
Yes, absolutely. Yeah. I mean, because and then it gets weirder. So, right. So what is the interplay with your body and those other substances you're putting into it? So what kind of, shifts in your structure, your function? So quite literally, like your energetic patterns you're making when you're drinking like alcohol versus when you might utilize something like psilocybin or cannabis or cocaine is the other example.
Yeah. Yeah, absolutely. So yeah, it's like sometimes massive interventions can help acute things, but yeah, we're talking about something perhaps a little more subtle, right? Just like somehow trying to frame energy and having a great way to think about it. Like I do appreciate the way like traditional Chinese medicine talks about it, but it's conceptually a little hard for me to want to propagate that,
Well, yeah, that's the other thing. I mean, like I said, I don't think that any of these explanations are necessarily wrong, but when trying to be viewed through the eyes of Western science, I'm not sure how many of the current explanations are, like you said, all that palatable. And so that's why I think it would be important to try to figure out a way to sort of translate this information into something that we as a culture can hear, because there's so many people when you start talking about this kind of stuff, like I even said at the beginning, in a somewhat pejorative way, even though technically I would say that my CIS certificate would certify me as a hippie. There's that could be used as a term of people who are just maybe not all that serious about things. Although, really, honestly, like I've met a number of hippies and they're very, very serious folks and a lot really, really smart. So it's maybe a little bit tongue in cheek there.
Yeah, totally. It's good to note, Matt. Like a lot of people don't pick up on tongue in cheek stuff. A lot of people are quite literalist. A lot of what I say on the show even is tongue in cheek. So sorry everybody if you don't pick it up, but hope you do. Yeah, this concept, like, where does it come from? How is it related to like the energy we see in physics and chemistry? Like, how is it the same thing? Like, are we seeing more, electron exchanges, like when our hands feel funny? Like, is there something else going on there? Like, is it your mitochondria ramping up or something? And it's like you're experiencing interactions or processes happening at the cellular level. Like, there's a lot of questions there, and it would be really cool if people took it seriously and like took it into a lab setting and really kind of dug in. It's also interesting to consider, perhaps, like okay, we might not understand what's happening at like the cellular level or mitochondria level or something, but we do kind of understand what the human experience is like. Like, what if we just kind of focused on that? And perhaps that's where a lot of these Eastern practices got their practices, their methods, and their kind of frameworks is just experience, as opposed to like hardcore laboratory study. But then we have to go, okay, what of it can we universalize? And what can we say is only like, Master Jim's experience?
Well, right. I mean, if you're talking about like hardcore lab study, let's think about that for a second. Like, how long really in human history have we had labs?
We've had good science for like 60, 70 years, like by today's standards.
Yeah. Well, I mean, you could extend that. Let's be generous. Let's even say 100 years.
Sure.
Okay. But 100 years is nothing in the grand scheme of humanity. And so, of course, like we've been having to use our subjective experience because we haven't had like a lot of tools to give us a little bit more of a quote unquote objective data to be able to go by. So yes, I'm sure that that's where all this stuff comes from. But also, like, talking about, so bringing this back to psychedelics. So again, in the training, and I certainly in breathwork, a lot of the concepts are we tend to hold a lot of just emotional energy within ourselves, and this is the reason why some level of body work is generally involved with psychedelic treatment. Whether that's just inviting the person to stand up, jump around, hold a pillow on their chest and kind of push against you. I know, sometimes people are touching the throat or kind of like rubbing on the person's back. And then for those who have experienced this, and this can happen too, not necessarily within the psychedelic experience, but like, when you have really intense massage, in that physical constriction is just let go, you feel that sort of sensation melting, but then you also might get something else coming up, whether that's like laughter or crying or heat. And so we observe these things and we feel these things, but I don't know how we're explaining what's happening. I feel like I'm talking in circles.
Yeah, it's interesting. So like at the end of a breathwork session, just to get really specific, very regularly what happens is people feel quote unquote extra energy in their hands. Their hands might feel a little funny. And this is like super common. This is maybe in like 25% of people roughly.
Yep.
And we don't know what that is from like the practitioner standpoint, but you're right. Like we do have interventions. What we say is like either press against your own hands or we'll press into your hands or like, yeah. And typically it goes away in like 40 minutes at the longest.
Yeah.
Yeah. It's this really interesting phenomenon. Is it just the thing that triggers carpopedal muscle spasms? Is it something different? Yeah. It's big questions. But at least we have the interventions, right? It's kind of cool that we can at least do something about it.
Yeah, that's the thing. I mean, so it's we're doing this stuff, but what are we doing? And it's so interesting though, because like this is kind of awesome. I mean, it sounds sort of silly to say, well, what we're doing, why are we doing? But
it's a new frontier.
I feel yes, exactly. And this really is I think the beginnings. I think the next few decades are going to get really, really weird. I think that we're going to learn so much more about human consciousness and being, and both the connection of the body and brain, and whatever else there is there. Because these, like I said, these tools are coming online very soon, and we're going to be able to do a lot more research from both the subjective and objective measurement of whatever's going on with some of these really profound psychedelic tools we have.
I would love to talk. I'm sure you've bumped into this guy, Mantak Chia. Have you seen him around?
Like
a big Qigong, Tai Chi guy. Very prolific in terms of like book output. It would be really interesting to like get in dialogue, like in the way that International Transpersonal Association used to have these big kind of like intercultural exchanges. Like, okay, what do we get? Like 20 psychiatrists and therapist grads from CIS and like, maybe 20 people between like Tai Chi masters and Qigong masters. Just like, this is their whole thing is like energy. And like, what would happen after like a weekend of discussion? Like, what could we come up with?
I don't know, but that sounds really awesome. I think that Psychedelics Today could probably try to set something like that up, and it could be a conference.
I'm in. That'd be really interesting. Like, what is energy? like energy exposed. Like, it would be just great to get more intercultural exchanges like this, because their culture, like the Chinese Asian culture, is like developed quite independently of the way we developed, and they've got some pluses that we don't have, and vice versa. And I don't want to say like it's all equally valuable. It's really confusing to go there, but it's like obviously, like if I have cancer, I'm going to want to go with the Western doctor. I'm not necessarily going to want to go get like spirit surgery. Though it could be interesting. Like maybe I'll do both, but I'm not going to rule out the chemicals.
So that's kind of the point too, because like, I think a lot of folks end up putting people like in little camps, and we're saying, okay, I'm going to do this, but I'm not going to do that.
Yeah.
And like say, oh yeah, all of the stuff over here is garbage and all the stuff over here is great. Or, but I really look at everything as like, these are all just tools. Some tools work a lot better than other tools, but it's the more tools you have in your toolkit, like the more like projects you can take on, or like the easier time you might have kind of working on whatever you're working on. So it's all important.
Totally. It's like there's so many traditions, and do we really just want to throw out potentially like hundreds or thousands of years of tradition, or should we try to learn from it?
Well, and then this is the other thing too, talking about going back to like the DO search. So I guess like there was a lot of writing in the 1940s by Dr. Sutherland on the concept of primary respiration of the breath of life. And he was getting a lot of his thoughts and theories more from traditional shamanic practices, where like, the folks there, they'd normally be living right outside the town. So they're of the village, but they're not necessarily of the village. And their job was to just kind of like monitor the world energy, so to speak. And so, and when you start to interact with them, they're trying to figure out, okay, how is your like energy sort of not vibing with the rest of, nature and humanity, and how can we try to get that back into alignment? Which maybe makes sense as to why, traditionally we heard like say even ayahuasca. This is a brand new phenomenon that they've got a lot of white folks going down there and they're giving them ayahuasca. Typically it was the shaman who was drinking the ayahuasca.
Mm-hmm.
And he was trying to communicate with like the broader universe and trying to figure out, okay, like that was used to diagnose the person. And then they'd give maybe some herbs or some exercises or something like that to do. But most times people were not tripping out like that. This is a brand new phenomenon, even for that. So all of these things are very, very weirdly interrelated. Like even like I said, shamanism and forms of Western medicine.
The way you phrase something, like how do we bring them more in harmony with like the vibration of whatever they're in, nature or the world? Like it made me think of music, because music is kind of like easy to talk about in terms of vibration, and like dissonant things like minor chords, like that just don't necessarily sound as like grandiose as like a major or major scale or something. Like how dissonant do you really want to be, and for how long? And like perhaps like explore a little bit of music theory, and like maybe there's something applicable there, like to go far out as far out as I want to go maybe today. Like Nikola Tesla said something along the lines, if you want to understand the secrets of the universe, look at vibration, frequency, something along those lines. Bad paraphrase, but something along those lines. And maybe there's something there, and maybe that's why Icaros are so important in shamanic cultures, or Amazonian cultures at least. And, song is so important globally.
So two thoughts on that. One, again, going back to like hard science stuff, just reading about some genomic theory and, this idea that we have like junk DNA, like probably 98% of our genome is supposedly non-encoding, but we're finding out that even though it's just like repetitive, like Tata strips, right? Depending on how they're organized, we're now finding out that these can be extremely, extremely predictive of like actually how, like what you look like different things such as like how you might metabolize caffeine. Like, so I don't know, I was just watching a documentary and this was on HBO. So if anybody has HBO Max, something about DNA, something that's on there. It was okay. But there's like some organization in China that was just taking people's genomes and trying to reconstruct facial features from just the DNA. And they're surprisingly accurate. They're not fantastic, but they're scary real. And so so I was thinking about this. Okay, so if this is supposedly not coding and it's just kind of going ta 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 ta, quite literally, that's sort of just variations in a vibration. So that's one weird thing. The other thing, talking about psychedelics, there are forms of sound baths and healing that can be extraordinarily psychedelic. What's the name of the place out by Joshua Tree? The Integratron, I believe.
I haven't heard of this.
I've not heard about this. So this is an architectural structure. It's out in the middle of the desert. I have not been there myself. I would love to go. Supposedly it's constructed in such a way that the acoustics are very, very perfect, and you can do some very, very massive sound healing and trip out. And I think the whole concept was to be able to communicate with aliens.
Perfect.
Sounds a very, desert.
I mean, yeah, that's what they do in the desert, I think.
Yeah, that's cool. But no, and that's very profound. So I don't know. I've never been there, but I do have a friend who's part of the meetup. Oh, we didn't talk about the meetup. We'll talk about that later.
I'll take a note to do that.
Yeah, Ben Savage, powerful Ben Savage. He plays a gong and he does some sound healing stuff. I had the opportunity to sit in on one of his sessions once, and it was very similar, at least to some of my more intense breathwork sessions. Just sitting there and just being like bombarded by this truck of waves from a gong. If anybody hasn't done it, I would highly recommend it, because I'm I'm really big into these like non-drug ways of trying to tweak your consciousness and allow yourself to reach some of these psychedelic states. And that's one thing I want to explore more of too, like my own work here.
It's huge. Yeah. So in Oakland, 2017, they had a light machine out there that was giving people very interesting visual experiences, if not full psychedelic experiences.
Mm-hmm.
I got, thankfully, somebody in my town actually just bought one, a friend of mine. So I'm really excited to like try that more often. I got to try it somewhat recently. It was for maybe like a half hour. It was really interesting. And then this gentleman named Soren Lowe, who has done a lot of work with Android Jones's people regarding like microdose VR. He developed this really interesting table with you put on these really nice headphones, and then they actually have speakers mounted in this kind of really nice bed. So you're getting like 8-inch subwoofers actually like blowing vibrations right into you. And he actually composed music just for it, using his phrasing was something along the lines of music production techniques from bass music, which is essentially like kind of the stuff the kids are listening to these days.
Sure.
Think Bass Nectar, but plus 20 years out, like the younger folks. And it's really, really interesting. And similar to your experience with Ben, like it was very, very psychedelic. This is non-drug. Only drug of the day was coffee. And it was very exciting. I'm really interested to dig in further. And like, what does this look like if we take the smallest dose of mushrooms? 0.3 grams or something like that. 0.2 grams. Who knows? I'm excited to try it. Maybe check it out. So there's so many new interesting technologies coming up. Not even to go to Neuralink type stuff, but stuff even before then.
Well, yeah, we'll get to the Neuralink in a second because I know where you're going with that. But yeah, I think it's very interesting. So how might we be able to use maybe some of these tools together?
Mm-hmm.
Because like, do you always need to necessarily take like a heroic dose of the equivalent of a heroic dose of psilocybin, or maybe you take a slightly smaller dose of the psilocybin, but then also we're attenuating the experience with both breath work and then maybe some vibration on top of it or something else? I think we might be able to create. Well, I think it might make it even more comfortable to invite people in too, like that, because they might feel like they have a little bit more. I mean, the biggest problem with psychedelics, or at least my biggest problem with psychedelics, is letting go of control.
Mm-hmm.
And the perceived sensation that you really are giving up all of control and you have none.
Right. How do we make that like a more gentle transition?
Right. And maybe if you say, okay, well, maybe you can adjust how much like vibration you're getting, or what I like to do, just at least in my own practice, like I try to coach people in breath work and allow them to use that maybe with ketamine some. Mm-hmm. And so they can kind of get deeper into, or not quite as deep into their ketamine experience just by breathing more deeply. And so they don't feel like they're like getting super scared that they're going out of space. But then oftentimes if they do, they're very happy they went. But still, I mean, that can be intimidating, and just feeling like you're a part of the process rather than just completely along for the ride. It's maybe, I don't know, more fun for some folks.
So like the 30-minute come up on ayahuasca for me was like probably one of the scariest things in my life. And I've put myself in some extremely life-threatening situations. So it's like, can I suggest that, wholeheartedly to people? It's like, yeah, maybe, but I have to put in that caveat of the fear.
Mm-hmm.
And, maybe furthering your point too is, from what I understand, good general medical practice is you want to prescribe the lowest dose of a medication possible to get the desired outcome. And so perhaps we'd be able to lower dosages by using different electronics systems.
Yeah. And I don't know. I like how you phrase that, and that, and maybe all of this bias is coming from my training. Because again, I'm a psychiatrist, but I'm a child and adolescent psychiatrist. I do also see adults, but as a child and adolescent psychiatrist, it's very, very much, entered into your brain to like start low, go slow. And then the other thing that I always say to everybody I meet with, like the less medication overall, the better, as long as you're doing okay.
Mm-hmm.
Right. But that caveat that as long as you're doing okay. But the other things that you can do are really the things that you can kind of heal. Most of these are behavioral. So, focusing on that more for healing rather than just like, oh, you take a pill and you feel better. Yeah.
Right. And it's kind of hard to frame it. Like, so you got Prozac on one hand, and you've got like things that you might only need to use 4 times max. And it's like, it's hard to like put those in the same category for me. Because like Julie Holland had a really interesting quote the other day on an NPR show. She was featured on, I think it was Fresh Air. She said, these drugs are not designed to be used for decades. Though plenty of people are on them fine for decades, but perhaps it's not the best to keep people on it for decades. And it's like, yeah, if you could just get by with 4 doses psilocybin, like that seems like the more optimal medical option, even if it's 5 to whatever grams of, mushroom equivalent, like scary math, hard math, but things we have to really think about.
Well, I think that these are things to think about, and these are going to be some serious questions that we're going to want to ask ourselves and figure out where we want to go whenever psilocybin becomes available. The challenge is currently psilocybin is not, and really one of the best things we have is ketamine,
right?
Or at least in this country. So, but even with that, there's some people that are almost like so depressed and not motivated to do anything, they don't even really want to go to the ketamine clinic, or they might be afraid to even try that. Interestingly, you brought up Prozac. I mean, ketamine is of the different psychedelics. You can absolutely take a medication like Prozac at the same time as taking ketamine. And so the way to think about
ketamine, that there's very few drug interactions, it seems like.
Yeah, well, there's a few, but most of the time you're not going to run into them. And again, if you go to a reputable provider that kind of like looks out for the drug interactions, they're not going to give you ketamine if it's not necessarily indicated. But you're right, compared to a lot of other things, it's not so bad. But point being, like getting back to like my general concept, and I don't know if I shared this before. So another analogy, talking about these medications, jumping off what Dr. Holland was mentioning. So if you take the concept that the body is a temple, right? Or the body's, you've heard of that before.
Yeah, for sure.
Okay. Right. So if you twist that a little bit and think about it, well, the body's a lot like a building, kind of a temple, but buildings are made out of bricks. And when stuff starts going wrong, it's very much like bricks just start popping out randomly all over the place.
Oh, feel that.
Yeah. At first, it's not that big of a deal, really. It's like not aesthetically pleasing, but not a lot of problems. But eventually it gets to the point where that building is very unsound and it's at risk of falling over. So the way to think about medicines, or at least the current medications that we have, is much more like a scaffolding to kind of hold up that building from falling over. You can put up. That does nothing to actually fix the issue of why these bricks are popping out, but it at least makes sure the building doesn't fall over. The things that can actually help with putting the bricks back into place are, again, the behavioral stuff like sleep, diet, exercise, some kind of mindful spiritual practice, and cultivating positive relationships. I mean, this is kind of my thing. And so like you want to kind of prop somebody up so they can make those repairs with the medication. Then they work on making those repairs. And then as bricks require some mortar, and mortar requires time to set, you need to give some of these interventions a little bit of time to kind of like, marinate and kind of like really stick. Then what you want to do is start pulling down that scaffolding rung by rung after a specific amount of time. The amount of time I typically would give would be like maybe 6 months. Some people are a little bit longer than that, but that's all in an effort to minimize the amount of time that somebody's on these medications. Because honestly, I feel that they're tools like anything else. And a lot of these tools are actually very, very useful for a lot of people. And that's the thing that I hope that we don't lose sight on. Like when psychedelic medicine comes online, that we don't have to demonize the stuff we were using. Will they be as useful as some of these new tools? Maybe not for a lot of people, but for some people, they might be very, very useful.
Yeah, absolutely. Like we don't want to demonize a monkey wrench just because there's something new on the block. Like these are all tools. Let's think of them like helpful tools.
Yeah. And just like you can use a monkey wrench to fix your sink, you could also use a monkey wrench to hit somebody in the head and kill them. Mm-hmm. I mean, like it's all in how you use these things.
Right. And it really bothers me in like kind of our contemporary psychedelic culture, like this hate that a lot of these meds get when they really are life-saving for a lot of people. It's just, I guess the problem is like balancing this thing. Like we see this tool that might be exponentially better for a lot of folks, but it's not going to be exponentially better for all people, for all, situations, symptoms, diseases.
Right.
Yeah.
And for some people, it might be not so great at all.
Totally. Like there's people that will die from, or like their cardiac situation is not appropriate for psilocybin or other drugs, or maybe you're pregnant and you can't really go through a full on psychedelic situation. There's a lot of reasons.
Sure, absolutely. I mean, safety considerations taken into account, but Groff even noted that you can probably get benefit with something like, because this was from LSD psychotherapy, you can get benefit with just about any condition like an extreme bipolar disorder, even possibly even schizophrenia, which we think is sort of taboo. But you really have to be an extremely trained clinician to be able to treat somebody like this, because really bizarre, difficult things can pop up. And if you're not prepared for it, then you might actually create more harm rather than good. And so, again, it's not that these things couldn't be helpful for certain conditions. It's just much more user beware. And how helpful will they be? I don't know.
Right. And further, Matt, like Groff had access to inpatient facilities, right? He was working with a very well structured inpatient facility where he didn't have to worry about what happened overnight. Like he knew his clients were going to be safe and not kill themselves or get injured. Whereas, most psychedelic stuff isn't really like, maybe it's residential for a week, but what happens the next week? What happens if the person needed 20 treatments versus 5? It's kind of
really good point. I mean, I would argue currently virtually all psychedelic treatment is outpatient at the moment.
Pretty much. Like maybe you get a little bit of overnight supervision with your MDMA stuff, but there has been fallout. Like I've heard of suicides from underground MDMA sessions the day after. Mm-hmm. And a lot of us in the psychedelic world feel like this is the safest one to work with. Perhaps I believe ketamine is, but it's kind of crazy to have that on your conscious for the rest of your life. And not to mention like, the family's grief over that situation. And did you actually trigger someone's suicide? Like these are considerations you got to consider. I'm sure like prescribers have this fear all the time. Like, what if that person dies? I just gave them, some tools that could be really dangerous. It could be life-saving, could be dangerous. Same, back to that monkey wrench analogy, I guess.
Well, to be fair, I mean, that is, I think that's, I would hope that that's on the mind of any good physician that is working with a patient whenever they're prescribing medications, and especially medications that can alter somebody's mood, and sometimes ones that can increase or decrease the level of impulsivity. Because like if somebody becomes a little bit more impulsive, or if they might mix with alcohol, which will make you even more impulsive, like really bad things can happen really quick. So yeah, I mean, that's always on at least always on my mind.
These negative outcomes, I think, at least in the popular side of psychedelia, isn't really discussed too regularly. Like I'm sure you discuss a lot of these risks and things like that in your CIS type program, but I just don't, how often did Michael Pollan or Gwyneth Paltrow talk about that? Not too often.
Well, yeah, and this is a really good question. I'm glad that you brought it up, because like I truly feel like I've been, as we all are, in my own little information bubble for the last number of years, and I'm not sure how great of a pulse I have on like what the general sentiment is as a culture of psychedelics. I understand that there is still a lot of stigma. There's a lot of interest, and I know a lot of people are reaching out about like, well, how can I obtain some of these treatments? But I'm not sure exactly where they're getting a lot of their information from. And I think you kind of hit it. I think it's probably more like Netflix and Michael Pollan right now. Yeah, I don't think that they're painting a certain picture that, while not inaccurate, might not be painting the whole picture.
It's so hard to paint the whole picture, like this.
Right.
There's this documentary series just came out called Unwell. And they actually did a 40-minute to an hour on ayahuasca, and they thankfully, I think they did a good job showing like, hey, look, like you can have a seizure in an ayahuasca session. Like it's not like wildly safe. Like it is pretty safe, but it's not like, it's not as safe as drinking a cup of water. It's pretty different. And there just are risks, and it's not going to be perfect for everybody. So I would advise people check that out. Netflix, Unwell, Ayahuasca. It was that facility in Orlando, Soul Quest or something like that.
Mm-hmm.
They claim to have, legal authority to be doing sessions in the States, though I'm a little dubious about it.
I have no idea, but I know that I've met a number of veterans that have gone through there and they've gotten great benefit.
Oh, totally. I always feel bad. Like I want to be like painting the whole picture, but I also see the miraculous benefit some people get. So I'm like, my God. I just want to be a little more like cautious and perhaps like, hey, there is a chance mid-session the DEA is going to bust in. And I hate to paint that picture for you, but they don't have legit permission from the feds. They may have filed paperwork, but this is another real risk. And like perhaps one of the biggest risks from psychedelics, doing it in the United States illegally, is jail. Like hepatitis and new kinds of trauma. Like it's no joke.
Well, and going back to the need for training of clinicians, not just jail, but notoriously, if you're having a really difficult experience, you might try to seek help by calling 911 or going to the hospital.
Yeah.
And then how are the police going to treat you?
Mm-hmm.
Not so great. And then also once you get to the hospital, like how are the physicians there going to treat you? Some of them, if you're lucky, they're gonna realize what's going on, say, all right, we just need to give you a calm environment, like they'll chill out. Other times, you're gonna find yourself in a psych ward and you're not gonna know how you got there.
Mm-hmm.
I've worked with at least a handful of people that's happened to.
It's tough. It's like I've talked to a couple ER docs that just say, oh yeah, you just need to chill out. You're just going to sit here for 8 hours.
Yeah.
And then others are like, Thorazine injection or whatever kind of like anti-anxiety, like sleepy meds they want to inject you with. Like Groff kind of has a lot of severe warnings about this, like possibly triggering like a stuck process and possibly creating new problems that weren't there before by, chemically stopping the psychedelic session. It's kind of creepy. I would love to see more data on that, but yeah, perhaps that's one of the better things we do here on Psychedelics Today is like give people research ideas. Like, hey, all these things need to be looked at. You need to do a master's degree. Great. Like dig in. Plenty of ideas.
There's infinite possibilities. Really, again, we're talking about the study of consciousness, which I am fully confident we are not going to find out way past my death, but that's okay. And actually, I find that somewhat, exciting because like this is a really hard problem that, humanity's been working on forever. And if we can even, push the ripple of the movement in a slightly different direction for a positive change, like that's an amazing feat when you think about the totality of the universe and how huge it is and how small we are.
Yeah. I read Chris Bache's book recently, LSD and the Mind of the Universe. I know I definitely don't want to do his protocol of like 73 500 microgram sessions, but he did have some really great insights in the book about like intergenerational projects. Like it's kind of like an interesting maturity. Like all of your projects aren't necessarily going to be complete, potentially for hundreds, if not like 1,000 more years. And that's kind of a cool thing to be a part of. Like, is it more mature? Like, or what is that? Like, how can we understand the value difference for humans on these projects that might last forever, perceptually forever, at least?
It seems like it's the ultimate delayed gratification.
Mm-hmm.
Or the other example that I think is often used, right, would be like the construction of the pyramids. Wasn't that supposedly done over generations upon generations?
Right. Cathedral's probably a shorter period of time, but still multiple generations. Yeah. Like it's really interesting. And what is that about? It's like, my understanding of Egyptian religion is a little funky, but they were doing it essentially for the thing they thought was God, to honor God, which was Pharaoh. And they got to play a part in that. And, same thing with cathedrals. Like they were honoring what they thought was God and, helping spread that message. And I think it's kind of turned a little bit. It's like inverted, whereas like the human is now like the God, like humanism, individual values and rights and all that kind of stuff. Perhaps we're veering into weird territory where English literature professor could be more helpful.
Well, perhaps. I mean, although you're kind of turning into the beautiful version of what Joseph Campbell talks about from all of his research, that all the different myths and studying the different world religions ultimately go back to, well, we all are God in almost all the world religions, which is interesting.
Totally. It's kind of a key psychedelic insight from high dose sessions too.
Right. And that I was just going to say that. So, and then also just thinking about, the building the pyramids thing and talking about how, with iterations with cathedrals getting easier and easier, the other thing that we're doing is we do get better at the things that we practice over time. And we tend to streamline processes. And we're talking about, combining different things. And you hinted at the neural link, because I know we had a conversation about this before. And I think it might be fun to sort of like bring up this crazy thought experiment I was having. I'm wondering if there's going to be a divergence in psychedelic medicines and how they're used, and you're going to have on one side the camp of the quote unquote natural medicines coming from plants and funguses and the world as we knew it before humans. And then we're also going to have like the synthesized compounds. But the synthesized compounds, I'm not sure if they're just going to be the singular compound. I think that what we might do is over time try to figure out ways of having very, very specific, reliably repeatable experiences mediated through the combination of psychedelic and some sort of a technology that neither the drug by itself would cause, nor the technology by itself would cause. But if you combine them two, you could have something. What that would be, I don't know, but it kind of feels like a little bit like Total Recall. And then on the opposite side of that, with more of the natural medicines, there's this constant exploration of like, okay, well, what is this broader universe all about, and how is like nature interconnected with everything else? And so like they'll be used for different purposes. And so then when you think about it, like when you're talking about, okay, well, the quote unquote, like the medicines coming from the earth, so to speak, versus like the synthesized version, it's like, do you want the blue pill or the red pill?
Yeah. Yeah, that's interesting. And they'll be their own kind of traditions. Totally. I think as you're saying, like you can go really deep down this kind of like space migration, life extension thing. Like what is our relationship to nature and the universe and all things? Yeah. And deeper lessons. It was interesting. Like, I think people should definitely check out this LSD in the Mind of the Universe thing, because it's so interesting. I don't think he would advise anybody go down this path, but it was just insightful to see what happens when you eat that much LSD over the course of 20 years.
Yeah. I have not read the book. I did have the fantastic opportunity to meet Dr. Baki at UPenn. I think it was like last year. He was giving a talk about this. It was before the book came out. Seems like a brilliant, extremely insightful guy. But also too, it's like he does have that eye about him of like people that have gone really, really deep. And I have to imagine that because I think you've probably interacted with more people within this community, that there's just a thing. I don't know how to explain it. It's like a different twinkle in the eye that you can just see in folks that have kind of seen more than, I don't know, what we're supposed to see or something like that. And it's
yeah, there's something there. There is something there.
Yeah.
But yeah, like Neuralink, we didn't really define what Neuralink is for those who don't know. It's this device that Elon Musk has a company that's developing to make some sort of like human computer interface that works, it's like a brain implant. I don't really know much more than that, but they've had some early successes with animals and humans manipulating devices. So, I think the end goal is something like the Matrix, where you can, interact at the speed of mind with devices, or at least at the speed of body and my brain. And yeah, it could be really interesting, could be really helpful for disabled people. And it could amplify folks that don't necessarily have disabilities, but want to do more in the electronic world, which is interesting. I don't really know how to take it totally. It's like a thing that's coming, but we don't really know like what to do with that, I guess.
Well, I mean, the base level, it feels like it's just an interface where you can just think about stuff and stuff happens versus where you have to do something physically to make stuff happen, which is a small change, but a revolutionary change. And yeah, things could get really weird. We could go to Borg, or we could go to Matrix, or we could go someplace else. I don't know.
Right. Right. I was actually thinking about this yesterday. Like people, it might do people good to expose themselves to more sci-fi. We're living in like wild times, and a lot of this was predicted by people writing science fiction in the 30s, 40s, and 50s. So, perhaps even further back with folks like H.G. Wells in the Victorian era. So, there's some interesting stuff back there that we can pull on. And Philip K. Dick, kind of notorious drug user and brilliant fiction writer, had a lot of really interesting predictive things. You already said Blade Runner. I think that was his book that spawned that movie. And
well, do androids dream of electric sheep?
Also that, yeah. Yeah. Oh, that was the origins for that movie, right?
Right.
Yeah.
Right.
They were like sniffing chemicals to like manipulate their mood for each scenario. And it's really fascinating.
And Total Recall.
I think more big films were made from his books than anybody else, which is super interesting. There was one like Alex Jones thing. What was it? So it was a Philip K. Dick book, highly paranoid. Like I think the essence of Philip K. Dick is paranoia.
Sure.
And like Man in the High Castle. Mm-hmm. But of course they picked Alex Jones because he's like the archetype of paranoid. And in a lot of ways, not in every way, but it was this, oh man, what the fuck? Scanner Darkly was the name of that one. And it was really, really well done. But, I don't think I can watch it more than once every 10 years because it's just so stressful, but it's a great film.
Well, that was the animated one, right?
So, yeah, weirdly animated. It was like it was real, but they added like weird layers on top of it.
Yeah, it was the same style as Waking Life, I think. Yeah.
Right. Yeah.
Good flick.
Exactly. Yeah. So, I think folks in this field could learn a lot from science fiction. It's my main point. With these drug interventions coming out with new devices all the time to manipulate the human organism and, every other organism out there. Like it's a really interesting deal. And it might help prep for the jarring changes ahead.
Right.
Yeah.
Which talking about, this might be a huge segue, but talking about the, your come up, the terrified come up on ayahuasca, and just dramatic changes in science fiction. As we've alluded to, we're still in the middle of the coronavirus pandemic, and all signs are pointing to we are somewhere in the middle. And it does feel like, and I got this concept maybe a little bit early on from Howard Whitehouse, and powerful Howard Whitehouse. He's part of the Erie group in California. But this is very much a global psychedelic experience going on right now. We're on the biggest trip that we have ever had, ever. And this is not going to be fast. This is like a baseball game. And this was months ago. He was like, I think we're in maybe inning 2 or inning 3. I don't know what inning we're at right now, but we're not too much further than that. But it does seem like we had that terror when everything first started, when we thought like, oh my God, like 20% of the world population might die. Mm-hmm. Right? We've now gotten way past that. So, okay, well, it's not going to be that bad. But I'm not sure if we've gotten to the point where all of the, like, the other traumas that we get to be able to be introduced to have all been shown to us yet. I think we've gotten some glimpses with that, with the whole George Floyd situation, but I'm not sure what's still on the horizon before this whole thing ends. And hopefully, just like a psychedelic experience, there's going to be a dramatic healing and growth that comes out of this. Although we'll all find out together whenever that happens.
Right. So this is another like interesting thing. So Chris Beisch was a student of Stan Grof, and
Mhm.
he had a lot of this perinatal stuff on his mind, and like
Mhm.
people love this kind of birth analogy for a lot of reasons. And it's painful, it's scary, it's really intense, and perhaps we're in this like I don't know when was this whole. I think it was in the mid 70s where like the Club of Rome issued this whole statement about there being limited resources on Earth and that we're going to run up against a wall eventually. And,
Mhm.
we've got to figure that out. And, now we've got like colliding possible catastrophes, everything from climate to resources to pollution to, war and nukes and, all of the problems that's discussed everywhere. They're all seeming to converge. And is this
Right.
like humanity as a single organism compressing against the cervix, like BPM2 type situation? Like it's not opening. We don't see, not many of us see a light at the end of the tunnel yet. Maybe there's a couple, but it's like, it's these birth pains of dying to what we were before to being born to something new. In the same way we talk about the birth perinatal matrices in Grof's work. And I really
Yeah.
appreciated Chris Beisch like kind of saying that stuff. But he's writing this stuff it's seemingly 15 years ago, not even like cognizant of corona or like global pandemics. So it's really timely for me to finish the book like 2 weeks ago. Like, can global civilization go back? Can we go back to what we were doing even 4 years ago? I don't know. It's really interesting. And it seems like a big catalyst for transformation.
I don't know, but again, the BPMs mirror very much the concept of the hero's journey, and I think
Yeah.
that's what we're all going through.
Mm-hmm.
Sure.
Yeah. And for those who don't know the Grof perinatal matrices, you got to read up on it. At least try to watch some YouTubes on it or read some of his books. I think LSD psychotherapy lays it out fairly well. Kind of a dense book, but if you're a clinician, you should be able to work through it.
Yeah, that is my all-time favorite Grof book and probably one of my favorite books on psychedelics. But more recently released, the Way of the Psychonaut Volumes 1 and 2.
I haven't touched those. Do you like them?
I'm not. I finished Volume 1. I haven't done Volume 2. Like most of Grof's work, it's he's rehashing topics that he's kind of talked about before.
Right. There's main points and kind of like fleshing out why.
Right. I do think that those books are a little bit more accessible than say LSD psychotherapy, but I still say if you're especially if you're a clinician, you're serious and you want to get in the weeds and think about some interesting stuff, LSD psychotherapy is my favorite.
Yeah.
But Way of the Psychonaut, very good too. It's also, I think, cheaper.
Right. Those are pretty big books, The Way of the Psychonaut.
Oh, yeah.
Kind of shocked.
No, not really.
No?
I mean, they're like, they're smaller. I mean, they're paperbacks and they're, I don't know, they're not very big. They are maybe like 300 pages a piece, but they're not, I mean, it's not like they're heavy. They're smaller than an iPad, let's say. So,
okay.
Whereas LSD psychotherapy is, I think, is like 600 pages and like, it feels like an encyclopedia.
Like that was my entry, man. I don't know if I ever told you that. Like I was reading this as like a freshman in my undergrad.
Oh my God.
What am I doing? This is so hard, but I'm going to finish it. So I was just like, doing my own kind of perinatal thing on my own, torturing myself. Brutal, but endlessly interesting.
I was already a physician and I've read it. I've kind of read it twice and I tried to audio listen to it once. And there's still a lot of things that, I'm not catching all the concepts. I mean, there's a lot in there.
Yeah. So. Amazing. Well, we're at over an hour, Matt. We didn't get a chance yet to talk about your meetup. I guess let's chat about that. So you've got some meetups in Chicago?
Yeah. So, I've been hosting the Psychedelics in the Future of Psychiatry meetup group for a little over 4 years now. We've been traditionally meeting about once a month to talk about all things psychedelic. Really started off as sort of a journal club. It was just me and, I thought it was literally just going to be me and like 3 friends hanging out in a coffee shop reading just journal articles. It's blown up over time. I think we've got close to 1,800 members now. Still have been meeting even through the pandemic. It's a little bit more difficult when you're not meeting in person. But the cool thing about doing some of the virtual meetings, we've been able to do some stuff like teaming up with the Madison Psychedelic Society as an example. I think we might do a lot more of that, trying to trying to make things a little bit more national or even global, just as, when you're online, you don't have like the physical constraints. But yeah, whenever we get back to meeting in person, it'd be great to meet some more folks in person. So that's just meetup.com. Psychedelics in the Future.
Cool. And, we had this idea of kind of helping the Chicago Metro kind of link up. So you and I might try to host some kind of low key meetups online, so folks can stay tuned in the Chicago and Illinois area. It would be cool to like connect with folks in that scene.
Yeah, we were going to, right? We were going to do a whole breathwork thing.
Oh man, yeah, we were gonna.
In Chicago.
I had a whole world tour set up, man. It was crazy. Yeah. I was like, 2020 is gonna be the best, and then 2020 fell on its face for me. But it's been really rewarding, regardless, working this way. Yeah, what was it? 2 months in Europe, like Phoenix, Santa Fe, Chicago. I think I had some East Coast stuff lined up in Princeton and like Boston. I was going to plan on that because my family's near there. It's going to be quite the year. But oh well, whenever this junk is done, I'm still game. And I would love to get to Chicago and all these other places.
Yeah, we'd love to have you here. But at the same time, similar to like how I've gotten a little bit more time to say read some books and kind of dig into some of these hard questions a little bit more. I mean, it seems like you and Kyle have been making some like just churning out amazing content.
Yeah, we decided to do 2 episodes a week. That was probably the biggest thing. And it's been really cool to like just talk, he and I. Yeah, so I appreciate that. But it's been really helpful.
Yeah. Well, no, actually some of your Friday, Solidarity Fridays, some of my favorite episodes we've had in the last few months. But yeah, keep up the good work. You're doing great.
Thank you. Yeah, we will. It's so fun. So great. Yeah. Cool, man. Anything else you want to point out before we wrap recording here?
No, just I guess I didn't mention I am opening a center eventually, although I wish I could tell you an opening date because I don't really have that. So trying to do some cool stuff there. Probably going to be trying to bring in some new clinicians of the Chicago area, get a sensory deprivation tank. And yeah, but like I said, TBD when doors are fully going to be open. But sooner rather than later, and maybe I'll pop back on, or we'll do some other kind of things like you were hinting at to talk about that whenever the time comes.
Yeah, I think that would be amazing. All right. Well, Dr. Matt Brown, really appreciate it, and hope we can get you on the show again in a few months, maybe.
Sure, man. Whenever. As I said, I think I might have more time to do this kind of stuff than I have the last couple of years. So I'd be happy to come back whenever.
Hello. How'd you think that went? That was a really fun episode for me. I think Matt was onto something there, and I'm glad we got to speculate and explore some really interesting stuff on the tail end as well. So that was Dr. Matt Brown from Chicago, and I hope you liked it. Let us know what you think. Email us over at psychedelicstodayemail@gmail.com. Maybe check out our Facebook group and have some conversations about it there. Psychedelics Today group on Facebook. And yeah, we'd just love to hear from you. If you want to support us, leave us a review on Facebook or any of your podcasting apps you use, or leave us a small monthly donation at patreon.com/psychedelicstoday. And we've got all sorts of classes available at psychedeliceducationcenter.com. I think you're going to like some of what we've got there, from navigating psychedelics for clinicians and therapists to the course on Carl Jung called Imagination is Revelation, and this newish one called Psychedelics in the Shadow, exploring the the shadow side of psychedelia. So a lot of great stuff available, and anything helps us out, and we can keep doing these amazing podcasts. So thank you all for tuning in. This is Joe Moore signing off from Breckenridge, Colorado for Psychedelics Today. See you next time.